Hi, in this video, I'm going to talk about how to decide whether to use an epidural or have a medicated birth. And I think probably the biggest thing is for you to really understand the pros and the cons of any type of intervention it might be, whether it's an epidural or a narcotic or anything that might be presented to you that might be an invasive type of situation. So with an epidural, we do know that there are people who will say, oh, you should always get an epidural. There's no reason to go through labor and delivery with the pain. But again, that's only part of the story. So there are definitely a time and a place for an epidural, and we should be very grateful for some of those things that have been presented into the world of labor and delivery to make things a little bit easier. But we have to remember that there could be side effects that may not be what we're looking for. So I would always ask the question, what are the pros and cons? What are the alternatives, including doing nothing? And what is the time frame? Because the other thing to think about is that sometimes in the moment that you want the epidural the most, you're almost done with labor and delivery. And so by the time it would set in, your baby may already be born. And so now you have the effects of the epidural while you have a newborn. So thinking about lots of different situations, the time frame of the labor and delivery, how it's progressing, where you are, and how you're feeling. So just some of the cons of an epidural, just so that you can know, it can slow down the labor process. So it would make the labor process a little bit longer. In some cases, there is a need for some of the synthetic oxytocin known as Pitocin to further your contractions. And those contractions are a little bit stronger than the contractions that you have with your natural oxytocin in your body. So sometimes there's a cascade of effects when that is given, where there might be some more pain with just those contractions. Now the epidural will help with those contractions, but what else are we looking at that may affect your labor and delivery? Now, if you're on that, you don't have the use of your legs. They're going to require perhaps an IV of fluid to make sure that your fluids remain high enough and you don't have a drop in your blood pressure, which is one of the side effects that could happen when you have an epidural. You would be more than likely tied to a electronic fetal monitor, and they're going to want to perhaps put a catheter in because you won't be able to get up to use the bathroom. So the epidural could take away the pain, but also could take away your mobility, which will directly affect the progression of labor and delivery. There are increased rates of cesarean births with an epidural because of some of the things that could happen. A mother can have a fever, your blood pressure can drop, the baby's heart rate can drop, so it looks like there's fetal distress, and then the C-section or the cesarean delivery would need to occur. It kind of becomes a more high-tech birth. So how much tech stuff and interventions do you want? Because it's not just the epidural, then we have the other things that go along with it, and then the increased risk of the slowing of the labor. Now, there are pros to having an epidural. It does decrease the pain, but helps you can still be awake and alert and oriented and kind of know what's going on and participate some. And you can rest. Now, sometimes, a labor can be pretty difficult and long, and mom could just become really tired, and that fatigue can also affect the progression of the birth, so it's not going quite as quickly. And so an epidural could give mom an opportunity to sleep and rest in for a little while, and maybe it's okay that it slows down the progression of labor because mom needs a break. And once that wears off and mom is a little bit more refreshed and can then get up and participate again, and with that decreased intention, you might even see an increase in the speed and ease of labor and delivery at that point in time. So I think it's really important that you ask all of those questions and you learn to ask all of those questions for all interventions. Again, those are, what are my options? What are the pros and cons? And in the options, what are all the options, the pros and cons of the options, including doing nothing? And I think that really applies to any intervention that they might offer you, including an epidural. Thank you.